So in kind of moving on from partnerships, we're trying to dive a little bit into strategies. And we constantly hear this: how do we scale successfully? How do we strategize better? How do we get better ROI? What's going on in business models? What are the successful ones out there? So we're really fortunate to have Wainwright Fishburn, who's a partner at Cooley LLP, join us for what will be probably a really interesting look at what's going on in the landscape out there. So let's bring him to the stage. Welcome. Thank you. Sorry, I clap a lot.
Thank you. All right. Thank you very much, Jill, and it's a pleasure to be here. So my topic today is supercharged scalability. And really, it's a perfect time to have this conversation because as someone who's been really involved in the digital health landscape since almost the beginning, I'd say going back 8 to 10 years, for the first number of years, we would continue to say to ourselves, okay, this is year 3, but it's really year 1 as things start to break forward. So what I'm going to try and bring to life today is some of the real breakout stories as you're seeing true commercial scale as a result of all of the deep investment that's gone into the sector. So let's see if we can get our slides going here. Okay, there we go. Security alert. All right, well, I'm just going to keep talking and maybe we can get some help here. Oh, they're loading them. Okay, great. So just a little bit of background on myself. I am essentially a venture capital attorney. I've done that for the last couple of decades now. So I spend my life at the crossroads of company building and the investment community. And so, there we go. So in any event, a lot of what I've seen over the years are companies that obviously are at the early seed stage, but the firm that I'm with, Cooley, is one of the iconic law firms that really has represented the cutting edge of new economy wherever that may find itself. So today we have taken a Silicon Valley brand of law and we're one of a very small core of firms that can claim the deepest of roots in the Silicon Valley. We've extended that throughout the country and internationally. And what I like to say about the way the firm operates, and it really, I think, informs my worldview, is because we are on the edge of the new economy, we don't know what we're going to be doing 3 or 4 years from now because it's likely has not even happened. So if you look at what we're doing today, we're doing all the privacy work for Facebook. We're representing commercial launch vehicles with SpaceX and Tesla. We're involved with Google. And we have some of the deepest roots in the life science industry where we worked as the founding lawyers of both Amgen and Genentech. So as I come to these conversations, what I'm often thinking about is how you can scale the companies that we're faced with. So let me talk a little bit about where I started. I did my law training up in the Bay Area. People thought, yep. Oh, we have a crash. Okay. I can keep talking. we'll get it ready while they're crashing. So in any event, just to give you my own background and perspective, so I did my training up in the Bay Area and people thought I was a little bit crazy 20 years ago when I moved to San Diego to help open the Cooley office of San Diego. And we had the privilege at that time of being involved with 5 public offerings the year we opened the office. One of them was Qualcomm and the other 4 were life science companies. So I still have on my desk the $8 million private placement memorandum for Qualcomm and have had the privilege of watching that company scale to well north of 100 billion in market cap. But the 4 or 5 life science companies, at that time they were traditional biopharmaceutical companies, those too scaled in their own way, but in a very different way. And if we aggregate today, they didn't probably aggregate $100 billion, but it was certainly several $1 billion worth of exits that came out of that small group of companies. So it was actually very natural for me to become involved in the digital health industry at the very beginnings as we were moving initially from Qualcomm in its early form, and then as Qualcomm was beginning to say, how can we expand making life with the cell phone a little bit more robust, they moved into digital health, and they, I think, were one of the very early and iconic groups that have, in many ways, I think brought about the building of the digital health ecosystem. And just to give a small example, while I'm kind of killing time waiting for my slides to come, and if not, we really will go get some, have another coffee break. So just to give another small example, what Qualcomm did in the very beginning is they started a forum called the WLSA, the Wireless Life Science Alliance. And in its early days, it was more or less a walled garden. And I'm just curious, show of hands, has anyone over the years attended any of the WLSA events? So yeah, so a few people have been involved. So what was important about that particular organization and what they did at the outset is Paul Jacobs, who is the now chairman, the then CEO, and really one of the strong supporters of Don Jones and Rick Valencia and Jack Young and others, said we need to just go explore. This is an area we don't know much about, and so how can we learn more? So he partnered with Ted Torfey, who was one of the senior execs at J&J at the time, and for the first 2 or 3 years, it was an invitation-only meeting, and both Paul and Ted sat through an entire day of sessions like this, just as people were beginning to explore what this crossover of the classic, sort of Qualcomm world of smartphones could possibly mean to the world of healthcare. And at the same time, Ted Torfey was trying to inform the conversation with their experience from the pharmaceutical perspective. So I'm being patient here, but I think I'm in the interest of, let me go check with Jill, see what she wants us to do. Jill, are you back there somewhere?
I am, and I'm sorry.
No, don't worry. Oh, okay. Do you want me to, because if you want to stay on schedule, I think I can. No, don't sweat it. I think I can keep going. Okay. All right, I feel like this is Wizard of Oz, but I'm going to do everything I can to keep us on schedule. She said the file crashed, and they're just in the process of. So anyway, so what I'm going to try and do today is I'm going to do a couple of things. I'm going to give just a very high-level landscape view of what I've seen unfold in the digital health arena over the many years. Have worked a lot with the various venture firms and have begun to inform my perspective on the industry from a lot of those meetings and relationships. We have formed a Digital Thought Leaders venture group that's been meeting now for probably 4 years, and we bring that group together, once or twice a year, and just in a very informal but small setting. And that's a group where we exchange ideas, we talk about where the trends are, we talk about some of the investment notions and the like. And so part of what I'm going to be basing my comments today on is really how we can bring the best of what has occurred over this last number of years. I feel like the Wizard of Oz. There we go. What has occurred over the last couple of years, and really identify the companies that are demonstrating the scalability in the industry. So we are up, Wizard of Oz. So that said, let's move ahead with a couple of slides. So the following is where I'll kick off. So this is a slide that I borrowed, or that Eric Topol gave me along the way. And I just spent the last couple of days in Philadelphia at the International Bio meeting, where probably 15,000 people gathered, and it's a classic, biopharma audience. But what they have done over the last 2 years is they have introduced a digital health track. So I think first that's a very important comment in and of itself. And Eric was one of the keynotes. But he loves this slide because he said, and this is now a couple of years old, but he said, where are we today? He said, we've got the car that's got 400 plus onboard sensors. We've got the iPhone that's got 10 plus sensors and 4 radios. And we've got the human with 0 sensors. So I used this slide a couple times ago, and somebody came up to me afterwards and said, that's not true. He said, the humans have lots of sensors. They're just no one is paying attention. And I think that's probably a little bit more effective way to think about it. So that goes to my next comment of, we all want to think about where this ultimately is going to go. There's been a lot of conversation today, and I'm going to talk a little bit about Fitbit later in the comments, but about what does digital health mean, in particular this early stage monitoring. So this slide represents, to me, one of the most important things that we have to recognize the path that we're on, and that's moving to the day that some of these digital health tools are totally ambient, meaning that you are not even aware that the data is being collected, And from that monitoring and sensing perspective, you then get meaningful guidance or management of either your health and wellness or your clinical condition. So the 3 examples are Misfit Wearables, which is a great company started by Sunny Vu and has had a lot of uptake both in Asia and here. But his thesis always was, we wanted our tracker to be part of your life, part of your lifestyle. And so that's one of their jewelry lines. This center example is a product from ResMed. So here's a classic medical device company in sleep apnea and CPAP machines. And they have recently released a product that is a sleep monitor. But what's particularly unique about this product is it is done without any physical contact. So you don't have to wear a tracker, you don't have to put a strip on the bottom of your bed, but you literally just set it up next to your bedside, and through a sonar and other radio frequency type technology, it is able to measure all of your your sleeping patterns. And so this is a sleep history that I did back in February, and it's interesting even to the little orange line that tells me when I got up in the middle of the night to use the restroom. But the most interesting one to me is the one on the the far side of the slide. So this is the work that's being done in the nanotechnology world right now, where what you see there is an actual radio combined with a biometric sensor. And so the notion is this will be an implantable sensor. It will be 24/7 with you, and it will be measuring any number of metrics and measures. And so that is, when you have these kinds of conversations, these kinds of meetings, that's where you always have to say is, where are we going ultimately? So it's a totally ambient experience with the early days. So let me now go to just a very quick landscape. And the only reason I do this is I get to pulling out of the landscape of venture investment the companies that demonstrate robust commercial success today. It's always helpful if you're Jack Young or you're a venture capitalist looking at where do I place my bets, you look at something like this. So you start at one end of the scale, which is the consumer end, obviously very straightforward, not a lot of regulatory involvement, but historically, consumer products and consumer-facing products have been some of the most expensive markets to reach, all the way to the clinical side. And then within those categories, obviously wellness and fitness. The rest are, broadly some measure of tech-enabled services. And moving up to the top, where a lot of people are focusing company opportunities these days are around, I like to generalize, 2 things. Either how to, in some way, revolutionize the stream of payments, or the other notion is how to revolutionize either the delivery and effectiveness of the clinical care, or to eliminate inefficiencies in the system. So that, from a very broad landscape perspective, is it consumer, is it clinical, and where is it on the value proposition perspective? So this is a slide that we've all seen, but this really begins to underscore what I want to talk about now. The real question is it a digital health bubble? So we've all heard and seen the Rock Health numbers, where we have last year the $4 billion that was more than the total of the preceding 3 years. I like to juxtapose that to the money that has actually gone into the venture industry overall, and you can see that in the 99-2000 period, it was the true bubble of venture capital, whereas now we've normalized. In those years, it was well north of $100 billion went into this sector. It's now normalized around 40-50 billion, and if you've got $4 billion of that going into digital health, you can see that we've got about a 10% stake that's going into the industry. If you look at the first quarter of this year, we have about 600 million that's gone in, so it's roughly on track, maybe slowing a little bit. But what I like to do with that number is look a little bit more deeply and say what is the composition of that. And I think it's very interesting because about 60% of the money, the $600 million that went into the digital health sectors in Q1 went into seed and Series A, and about 21% went into Series B and beyond. So the big investments in that period were ClassPass at $40 million, which is arguably digital health, but it's really much more about accessing fitness and other classes, but it's included in the sector, and Collective Health with about a $32 million investment. And then in Q2 so far, one of the big investments that's been announced is Doctors on Demand, which was about a $50 million investment in a Series B. So the comments that I would make about that overall landscape are as follows. First, Bill Gates made an interesting observation of the 2000 bubble. He said, Yes, it was a bubble. Yes, a lot of money was lost. But the truth is, had there not been the enormity have into the number of companies, back in the day, Amazon.com and others, we would not have progressed anywhere near as quickly as we have progressed over that period. The other thing that I would say is probably different in the current landscape, and I'm going to talk about that in the next couple of slides, is the quality of the investors that are in this sector are very different than what was happening in the 2000 period, because during that period, a lot of brand new first-time funds were put together. It was easy to get money because everyone was moving into the venture world, but they were quickly washed out. The one caveat that I will see, and I think my talk today is really a lot about the breakthrough models and the fact that we really do have some robust commercialization that is upon us. What I am observing is I think there is, and we talked about it a little bit earlier, an awful lot of energy and an awful lot of money that's going into early stage startups, seed and Series A, and I really do think that we're getting a lot of duplication in some of the places on that map that I showed you earlier. So if you're thinking about it from either where to start a company or where to spend your life energy, or where to make an investment, it'd be really carefully thinking about where the white space is in those graphs as opposed to going into a very crowded area. So let me now move forward to a little deeper set of observations. So the active players in the digital health market really underscore my point that these investors are the investment groups that are what I would consider the long-standing craftspeople of the venture industry. So these, firms like Venrock, Sequoia, Kleiner, Canaan, Norwest, and others have been doing this for a long time, and one of the things that's interesting about these groups is many of them have crossover funds where they've got a depth of expertise in tech, a depth of expertise in life science, and now as they're moving into digital health, they're drawing on both those sets of disciplines. I also like to call out the more recent players that I would call the tech power players, such as Social Plus Capital that started their fund in 2011, Andreessen started in 2009, and even Khosla Ventures, which has been, Vinod has been iconic back to his early days with Sun, and then Kleiner, but he started his fund in 2004. So here's what I really like to take a look at that's also very different about this environment. And I think you touched on it as Jack Young was talking a little bit about his activities in the new fund, which is still a Qualcomm meets Novartis. So it's a $100 million fund, but it's Qualcomm at 50, Novartis at 50, and then together they're working in the sector. But the strategics that are involved in this industry are making a difference in the venture investment world far more than strategics have ever had an impact in the past. And the examples are in two ways. First, the payors and the providers are also the ones that are providing the exits in many of the cases, and we'll talk about that in the next slide. But also, the strategics are taking very both meaningful stakes, and they're also leading deals, and that's not happened, I think, historically. So all of these are the factors that tell me that this is not a bubble that we're facing. So this is the slide that I think that really tells the story. There are an extraordinary number of very well-funded companies, and what I'm going to do over the last few minutes of my talk is to look at the sectors that we laid out at the beginning, and I'm going to try and do a couple of deep dives on the companies that have really broken out. But if you look at this slide, the number of companies where 50 million or more in venture funds have been raised, where 100 million or more in venture money have been raised, the acquisitions I mentioned, and then the most important new development I'd say over the last year or less have been the number of public offerings and the number of digital health companies that have now joined what I call the $1 billion club. So you've got Evelyn that just is a recent public company I'll talk about a little bit more that is a $1 billion plus market cap, Viva at $3.5 billion, IMS Health at $10 billion, and then the news yesterday with Fitbit, which was really stunning, and we'll have some fun talking about that. So moving from here, let's think about, again, this continuum. So in my mind, the continuum goes at the simplest level, but a lot of robust companies have been built, is just the basics of monitoring. And I'm one that talks about the people complain, well, gee, people don't wear the monitors. And I confess, my monitor, I went scuba diving a couple weeks ago and forgot to take it off, so it didn't survive. And now I'm one of those people that that put it in the drawer for a while, but I've got a new one that's waiting for me when I get back. But my comment about these monitoring devices at the pure consumer level is they're beginning to develop a consumer awareness and a consumer relationship with your own individual data in ways that consumers have never had that relationship before. So I'm pretty tolerant. I'm saying we're in the early days of all of this. So if the data is not perfect, if that sleep data that I picked up is really not that insightful, or it may be not perfect, I'm not troubled by that. What I'm more interested in is it's beginning to give me an interactive relationship with the data loop that I can create with tools that have not been available before. The middle box is where I think a lot of company activities are taking place right now, and this is taking that basic information and organizing and analyzing it. And the companies that I'm going to talk about here are companies that in my mind are doing some of the hardest work, and those are the companies that have decided in one way or another to tackle the healthcare system, the clinical healthcare system, which is a very, very challenging place to build a business and a business model. And then obviously at the far end, when you're able to take that information and make it actionable, which is what everyone clearly focuses on at the end of the day, that information in and of itself doesn't do much without being able to have some actionable results. So let me just take a quick run through the monitoring area. And the point that I want to make here is, again, the bifurcation between the pure consumer-facing products and the products, the companies that have developed products that are FDA regulated. So the line of demarcation that I will talk about here is sort of the Fitbit, Jawbone, Misfit on one side of the spectrum, and the AliveCor and TellCare, which both have FDA cleared devices on the other. So here again, we have to have a high five. And I think yesterday really was a very important day for a lot of reasons for this industry. First and foremost, it did represent, or does represent, if these market values hold, an extraordinary success for investors that were some of the early investors in the industry. Secondly, I think what you see is when that S1 for Fitbit was first exposed, I think a lot of people were blown away by the numbers. They had no appreciation for how well this company was doing, because a lot of that as a private company was not yet in the public eye. And we talk about the size of the market, and their CEO was quoted yesterday that he believes that Fitbit now controls 85% of the fitness tracking market, according to this quote that was in Bloomberg. Here's just a quick look at the numbers that I'm sure you've all seen, but how quickly the revenue numbers grew from 2012 all the way to 2014. And so the real question now, is it sustainable? I'll use Amazon as a good example. I mean, people asked early on, are people really going to buy books, over the internet? And because they were one of the first movers that got the full supporting, and all of a sudden were financially strong, the ability to expand not only their base business, but to begin to pivot is where I think people are going to be focusing an awful lot into the future. So these are the two devices that I wanted to call out that are the FDA cleared devices. So one is the AliveCor device, the other is the TellCare device. And the important point about each of these is, I think while in many ways, if you talk to Dr. Dave, who is the original founder and inventor around the AliveCor device, it was such a phenomenal device that allowed you to have that capability that it was seemingly obvious that everyone was going to want it. But it's taken the company some time to find what I would call the fast water, and now I think they've done an incredible job of making an FDA-cleared device available for direct consumer purchase, and then you can interlink with a support feedback loop that allows you to essentially monitor your own cardiac rhythms, but then get quick feedback from either an automated or a live person, live cardiologist, about what the implications of that particular set of data is all about. So to me, it's a good example of something that in the very early days we thought, oh, this is an iconic product, but it's taken them, in my mind, a little bit of time to find the essence of the commercial story. So let's now go to this middle category, which is the organize and analyze. And here I'm going to call out three companies that I think have been phenomenal examples of why this industry is definitely making an impact and why they're here to stay. I'm going to do a little deeper dive with Airstrip, but it really is going to demonstrate the fundamentals that all three of the companies have had to encounter as they've moved through essentially knocking on the door of the clinical setting. So let's take a look at some of the common denominators. So this is the profile of Airstrip. What I would call out again is it starts with the quality of investors. So their early investors and their continuing and sustaining investors were Qualcomm Life, Wellcome Trust, Sequoia, Lear Inc. But then the other thing that they did very wisely is their investors also included top players in the industry they were going to serve. And so now you can see that there are over 30,000 clinicians that are using the product, and it's live at about 300 hospitals. So that did not happen easily. One of the other points that I would make is Airstrip has been years in the building. So this is not an overnight success. This company was started in 2014, so it's 11 years old. It started with originally a fetal monitoring, and then again did a classic pivot. So this talks about what they did in the early days that made the difference. In the early days, they had some early innovators that were willing to support the company when it was very much experimental, almost whiteboard. They then went from there, and those were groups like Dignity Health, University of Michigan, to name a couple. They then went to what they called the early majority, and these are starting to get traction, so Tenet, Ascension Health, Cleveland Clinic, and others. And then ultimately the late majority, the Veterans Administration, Mayo, and others. But it has yielded a 25% of US hospitals in one way or another use this Airstrip product that I'm about to describe for those of you who may not know it. And that is 1,400 sites, which is a pretty substantial entry into this market. So this gives you a pretty good understanding of what these companies have encountered as they've moved into these clinical settings. They have multiple devices that they are having to deal with, whether it's smartphones, tablets, desktops, whether it's monitoring devices, whether it's the infusion pumps, you name it. But all of these are of the world of devices that are very disparate that they're trying to bring together. They're looking at multiple types of data, structured data, unstructured data, streaming, both monitoring and med device outputs, lots of different settings, pre-hospital, hospital, post-acute, community-based cares and the like, and then of course multiple vendors, Philips, Epic, Cerner, and the like. And one of the things that's important about this slide is as we talk about what's happening in the macro picture of healthcare, there is no question that there is a consolidation of all of the healthcare enterprises at the clinical level. And so even if you've created a pristine group, call it Florida Hospital, and you're on Epic or you're on Cerner, and all of a sudden, as part of this either grow and be part of the bigger ecosystem or be acquired, you're going to acquire systems that are probably not on the same platform. So even if you've done everything beautifully in your setting, this problem is one that is going to be more and more widespread as we see some of the consolidation that's inevitably taking place. So that's the environment they're faced with. And what they've done is they've taken that rat's nest and they've dropped it into a very elegant interface for the healthcare provider. So this particular screenshot shows you when you talk about the dashboards in my earlier slides. It looks rather simple, but if you're a care physician, it gives you all the patient demographics that you need, name, rank, and serial number. It talks about allergies. It talks about the care team, who else is on that care team. It talks about both the diagnosis and their other complaints, and the list goes on. What's important about this is it's also real time. So you're getting real-time vital signs, real-time feeds from the medical devices, real-time waveforms, which is not simple, and then it even translates down to the home health. So this is the example of a company that's brought that all the way through. So here's what I think this demonstrates. I guess you're not going to be the second part of the slide here, but let me try one more. Actually, it's not letting me forward at all, so maybe I'm stuck. There we go. So where they started, they started in an environment where it was a system-driven technology, and you can see the systems across the top and all the problems that they faced. Moving now to much more of a patient-driven technology. And we can all listen to the talks that have taken place over the last number of days or any of these conferences that you go to, and everyone talks about this basic principle. But what I'm trying to do is I'm trying to help you understand what it means for a venture capital-backed company to be successful, to be a commercially successful company in this environment. And these companies I'm going to talk about now represent that. So let me now move on to, very quickly, the last couple. So Health Catalyst is another terrific example. So they have a valuation that now is in excess of $500 million, last that we can tell. They recently have raised roughly $170 million. Again, common denominator, some of the best investors in the business. So their proposition is really to go into the clinical setting and to help create data warehouses of all of the existing information that is within the clinical setting, try and examine that information, and look for the obvious opportunities for improvement and for elimination of the inefficiencies. And this next quote is one that I like very much. So it's talking about a deal that was signed with Allina Health and Health Catalyst. They've signed a definitive agreement, and it's about $100 million in value to combine technologies. But what's important about this is this 10-year agreement marks the culmination of a relationship that began in 2008. So again, I'm trying to show the longevity of what's been going on. They have also, Health Catalyst has also had recently announced an incredible consolidation or collaboration program that they've done, consortium, with all of the children's hospitals. So you're getting hospitals, children's hospitals across the country that are willing to share their data together on this platform, and from that look for the common learnings that will make them all be a little bit better, a little bit more powerful. Another great example is Evelyn Health. Again, this one is different because this has been a rocket ship. It was founded in 2011. They had their NASDAQ debut this year, $195 million, already north of $1 billion market cap. And again, a quote that really says the essence of what we're talking about here, that they have a long-term partnership with the Evansville, Indiana-based health system. They're working directly with leadership and physician teams to optimize population health and the medical home infrastructure, and to create a financially integrated model that essentially is strong enough and robust enough that they're willing to open their whole story to the public by being a public company and expose their margins, their growth plans, and so on and so forth. So these are the robust companies that I think we have in front of us. So just in closing, I'm going to go to my last slide, which is the last place on the continuum, and that's the action. How do we make all this come to action? And my point that I'd like to leave with you here is where we're going. A lot of what we've seen in this first or second generation of companies are companies that are taking the existing measurements, the things that we've always known and been very comfortable with, blood pressure, heart rate, pulse oximetry, waveforms, and the like, and they basically brought those onto the dashboards like the one that you've seen for Airstrip. What I think this future is going to be is how we begin to measure and access things that we have not used in the past for the insights, clinical insights, using tools that are before us. And so I will call this the omics revolution: genomics, proteome, the microbiome, and then the exposome, which is sort of all of the things that confront us. So in closing, I am extraordinarily excited and proud of a very robust group of companies that are on our landscape. You're beginning to see it every single day. And my take-home message is it is going to be, I think, a survival of the fittest. The big companies are strong, robust, and getting stronger and more robust. I'm a little concerned about the velocity of capital and all the buzz that's going around the startup community. So I'm hoping that pragmatism and rationality hit that community. But the continuation of innovation there is fundamental. And my final point is I think it still needs to center around the importance of the physician in clinical-based decision-making. But we're really, at the end of the day, making the physician a better equipped part of our team. So with that, thank you very much. Sorry for the couple of hiccups, but we did it.